Hi everyone, welcome to the CANPoint Point Prevalence Study Site Initiation Visit. So my name is Marie-Hélène Masse. I'm the Clinical Trial Manager of the study. So today the presentation should be around 20 minutes. We'll have about 10, 15 minutes at the end for questions. If you have already attended the the meeting in July or in March, you don't need to attend this one as well, but you are welcome if you want to refresh your mind. It's really similar to those previously given in July and March. So we'll start with the list of items that we will review today. So the context of the study, the essential documents needed for activation, study training, site activation, the objective and outcomes of the study. We will show you a flow chart of the study. We'll discuss about procedures. We'll go over some portion of the CRF and the database as well. We'll review definition of ICU and categories of ICU, a few instructions for specific questions in the CRF, and study reimbursement, information about study reimbursement, and questions at the end. So, as I said, I'm the clinical trial manager, but on the call today, we have Julie Menard and Monica Sheen, who are the research coordinator, also working on the study. So, you will be in contact with them because they will be looking at the data you will have entered. They might put some queries. They might contact you by email. And Julie is also the point of contact to send your essential documents of your site to be activated. And if you have any questions, they are available to answer these questions for you. Joanne Martineau is our administrative assistant, so she will be the contact to reach regarding payments, site payments, and administrative staff. As you know, principal investigators of the study are François Lamontagne and Neil Abikari, but there are also co-investigators to this study, so Dr. Fowler, Dr. Murphy, and Dr. Coe. So essential documents. So we made this list of essential documents to activate your site, and it must be sent, all these documents must be sent before December 2nd to Julie Menard. So we need the protocol signature page signed by the PI. So you can find this document on page 4 in the research protocol. We need a fully executed site agreement. We need RED approval, institutional approval where applicable. We need your delegation log completed, and for the site investigator only, we need the certificate of good clinical practices, the CV, and the medical license. And by the way, the PI must be a physician. So all these documents must send before December 2nd to Julie Menard. But we also ask you to keep on site the GCP certificate, CV, and license of each person that is listed on the delegation book. So please keep that in your regulatory binder. And today we are doing the study training. So each person listed on the delegation log must be trained on the study. So for those who can attend the training today, you will document your training on the document that you see on the screen that you can find in the operation manual. For those of your team that are not able to join today, they can watch the video that is available on the website of CANPoint. So they watch the video and then they complete the training log, and they need to send this proof of training to Julie Ménard also. So as soon as you will have sent all the essential documents to Julie and the training log also completed to Julie, you will receive an email confirming that your site is activated, and you will also receive an email giving you access to the RedCap database with your ID and your password. So the objective of the study are to advance the development of a learning health system for critical care in Canada. At the system level, we want to create a contemporary registry of level 1 to 3 ICUs across Canadian acute care hospitals and determine occupancy rate at 3 time points during each calendar year. At the patient level, we want to determine the conditions and disease that define the burden of critical illness in patient admitted to level 1 to 3 ICUs. At each time point, uh, each point prevalence time point. At an intervention level, we want to determine the resource-intensive intervention delivered to individual patients admitted to these ICUs at each time point. And at the research infrastructure level, we want to identify the ICUs that are able to collect and submit completed patient-level data to these point prevalence studies and the barriers encountered by non-participating ICUs. The outcomes are the ICU level and occupancy rate, the conditions that define the burden of critical illness in patients admitted to Canadian ICUs, the resource-intensive intervention delivered to ICU patients, and capacity to participate to this point prevalence study and barriers encountered by non-participating ICUs. So now you see a flow chart of the study. So as you know, we sent about 300 inpatients to Canadian hospital with an acute care ICU. And we had already 2 time points, so one in March, one in July, and now the last time point of this year is December 9th. So it will be the third time point, and we will collect data about ICU in your hospital and also patient hospitalized or awaiting ICU admission at 9 a.m. on the day of data collection, which is December 9th. So now the procedures. So all patients admitted to the ICU of participating sites will be included. And as I said, we have invited all acute care hospitals across Canada to participate to this study. There are no exclusion criteria. So now what we ask you to do is on December 9 at 9 a.m., we ask you to look at who is in your ICU. So on a master list, like a document where you will have the patient chart number to start your data collection. You will collect all the patient chart number of all the patients that are hospitalized in your ICU, plus the patients that are awaiting ICU admission and that are already under the care of the ICU physician. So once you will have all listed the patients, then you will start data collection. But it must be done on December 9 at 9 a.m. Then it's like a screenshot of the list of patients that are in your ICU at this specific time point. So all data must be collected prospectively. So on December 9, you can start to collect data on paper, on the CRF on paper, and then enter it in the RedCap database, or you can choose to enter the data directly in the database. We give you 7 business days to enter the data, and Monica and Julie will look at the data. They might ask you some questions and put some queries in the database, and we ask you to answer these queries within 7 business days. So 7 business days after December 9 is December 18, I think, Monica and Julie. That's what we wrote, I think. And then as soon as they put some queries, we ask you to answer these queries. If you can answer it like within 24 hours, we would be really happy to resolve this as soon as possible. So there are two versions of the CRF. So one for adults and one for pediatric patients. So you must select the right version depending on the age of the patient on the day of data collection. So on December 9, if the patient is 18 and older, you select the adult CRF. And if the patient is 17, you select the pediatric version. The CRF and the operation manual, they are both available on the CANPoint website. So please make sure you have the last version, and you can confirm that by going on the website and downloading the last version of the document. So once your site will be activated, you will have received your username and password, and you can access the REDCap database. And that's one thing really important. So the first time that you will enter your first patient for this time point, you will need to answer the red question at the bottom here. Is it the first time that you answer questions about intensive care unit in your hospital? So you need to answer yes for the first patient you enter on December 9. So even if you participate to previous data collection time point in July or in March, you still need to answer yes to this question for your first patient because the number of funded bed might have changed between these two dates. So you need to answer yes to this question, and then you will have to provide the number of ICUs that you have at your hospital. So in this example, there are 4 ICUs. So when you will indicate 4, then you will have for each of the 4 ICUs, you will have to answer questions like you will have to provide a name for each of these ICUs. You will have to choose the level of ICU. We'll see that in the next couple of slides. So level 1 to 3 ICU, you will have to define if it's adult or pediatric population. You will have to provide the number of funded beds, occupied beds, etc. So that's really important to fill out these questions for your first patient that you will enter. And now definition of ICU. So that's a difficult task to do, to provide a definition of an ICU because people have different opinion about that. And we wanted to be more inclusive for this study. So meaning that I won't read this line. This text is in the operation manual. And we want the research team to look at this definition and sit with your local principal investigator and discuss about this and decide which unit in your hospital qualifies as an ICU. So if usually you say that you have 3 ICUs in your hospital, please make sure to look at this definition because you might have more than 3 ICUs according to this definition. So this should be, this discussion with your PI should be done before December 9 to make sure that on December 9 at 9, you know in which unit you have to look and list the patient that are in your ICU. And then you will have to select if for each ICU, if it's a level 1, 2, or 3 ICU. So again, these definitions are in the operation manual, and please look at this before December 9th. If you still have questions about ICU, and you're not sure that you have that a unit qualifies for an ICU, please send an email to me, François and me, and we will help you to decide if it should be an ICU. And basically, we will ask you what the question, like what distinguishes this unit from ward and what distinguishes this unit from from a regular ICU in terms of nurse ratio and prevention that can be given at, in this unit, etc. So don't be shy of sending this email if it's still not clear with you after going over the definition in the operation manual. So in the database, there are some research teams that have access to more than one hospital. So for these teams, please make sure that when you enter data, that you have selected the right hospital. So in the blue section, you have the name of the hospital, and you have a blue button on which you can click, and then you will have a drop-down list with the names of the hospital that you have access to. So you just have to click on the right one and then you start data collection. Instructions for specific questions. So in the CRF, we asked two questions about ethnicity and gender. So we want you to answer if it is documented in the medical record or not. We don't want you to assume an answer if it's not in the medical record. In fact, just knowing if the information is in the medical record or not is it's an information that we want to know. So if it's recorded, fine, you will answer yes and you will select between the choice of answers. If it's not recorded, you simply select no and that's it. Comorbidities. So please make sure to read the entire definition of the comorbidities because sometimes, like for example, MPOC, the definition, like you could check yes rapidly, but please make sure that you read the entire definition to make sure that the patient qualifies uh, um, for this definition. Primary ICU diagnosis at ICU admission. Sometimes it's difficult or not clear in the in the notes. So in that case, you could also refer to your principal investigator to clarify and select the main reason for ICU admission. Baseline severity. So these are related to calculate the Apache score. So this is the raw data of the Apache, which normally are collected within 24 hours following ICU admission. But if the patient was admitted before December 1st or on December 1st, you won't have to collect data on Apache. So if you enter this date, December 1st or before, like all the raw data will disappear in the field for the raw data will disappear in RedCap. So this means they are not needed. If your site in the medical record, you have access to the final score, meaning that in your medical record, it's calculated within the system and you have access to the final score, you can choose to enter only the final score, but it must be the system that has calculated this. We don't want you to collect data on a separate sheet and enter your final score. If it's not available in your EMR, this final score, you need to collect all the raw data in the CRF. Um, Regarding the window to collect the data, there might be some special cases where the patient was admitted to the ICU just few hours before December 9 at 9. So please refer to the operation manual. This will avoid a lot of queries from Monica and Julie if you refer to the operation manual. Temperature. So we know that temperature can be measured by different, so core, oral, axillary, tympanic. So if you have multiple measurements of temperature within the time frame of the Apache score, please record the lowest and the highest of all of them, and we will be able to select the right one and convert to core, uh, like with the data that you will have provided. Pre-F ratio is one item that um, requires a lot of attention, and we would like you to go over the instructions that are in the operation manual, but because it's always the most frequent source of queries from Monica and Julie. So if you want to avoid having a lot of queries and like go over all the patient after having completed all of these, you should go in the operation manual before starting data collection to make sure that you do it correctly. So I won't go in details, but please go over the instructions in the operation manual. So interventions, that's at the end of the TRF. We want you to look at the 24 hours prior to December 9 at 9. So we want you to look at the intervention that were received um, from December 8 at 9 to December 9 at 9. So you shouldn't have to look after December 9 at 9 in terms of data collection and intervention received. It's all before December 9 at 9. And by the way, enteral nutrition, if the patient eats by himself, it's not considered as enteral nutrition. Um, and one last thing is, so the patients that are awaiting ICU admission, so for example, they are in the emergency room, they are under the care of the ICU physician, they are waiting their bed in the ICU. So for the window of the Apache, you will consider the time that they were under the care of the ICU physician as the time of ICU admission for the data that you will collect. So you should not enter any date after December 9 at 9. So you will have a query from Monica for sure if you enter a date of ICU admission that is after December 9 at 9. If it's really the case, like the patient was not under the care of the ICU physician and was admitted after December 9 at 9, this patient shouldn't be shouldn't like there shouldn't be included in data collection at this time point. So if you enter any a value outside the accepted range, you will have a message asking you to confirm that you really want um, to enter this data. And just before I know I see that you have some questions, but I just want to give you information about study reimbursement. So for the new sites that have not yet participated to the previous data collection point, you will receive a startup fee of 1,000 as soon as you will be activated, plus $45 per chart. Um, but you need to make sure you collect data of all the patients that are hospitalized in your ICU. So if you have 15 patients in your ICU, you must collect data of the 15 patients in your ICU. You cannot decide to collect only 10 patients out of the 15. So we really want to see the right um, screenshot of the patients that are hospitalized in your ICU. We want data collection complete and entered within 7 business days. So before December 18, we know that Christmas is coming. And like we ask you to enter this before leaving for Christmas. And we ask you also to resolve the queries as soon as possible, but in a maximum of 7 business days. Payments will be sent in January when everything will be clean in the database. You don't need to send us invoices. Joanne will send the payment with the details of the payment. And I'm done. So happy to answer questions.
Marie-Hélène, we have a question in the chat about is CCU considered part of the ICU according to the definitions that you just showed a few minutes ago?
So it can. It depends again on what distinguish this unit from ward and from ICU. If it's rather closer to an ICU than a ward, we will consider it as an ICU. It's really depending on the care that you can give, the intervention. Can you give vasopressors? What is the ratio of patient per nurse? So I suggest that you send an email to me, François and Neil, describing your critical your CCU, and we'll help you decide if it should be considered as an ICU. Any other question, or Julie, Monica, anything you wanted to add?
Hi, my name is Rick. Can I ask a small question?
Yeah.
I'm not that familiar with the Apache 2 score. I'm taking over the study from Aaron here at the Neuro, so I'm just kind of logging in for the first touching base for the first time.
Yeah.
Is this a form that is filled out within the ICU?
So the Apache score is an indicator of
Mortality, right?
likely mortality.
Yeah,
If
yeah.
the score is high, like if it can be until 70, I think, or 72, but like usually we see between 20 and 40, I would say. And if the score is high, the patient has more chance to die. So that's really like something, a score that we describe or we put in the publication at the end of the study. In the results, we put the mean, normally the mean Apache score of the patient that were included in the study, and it tells us how sick were the patients. So
So
we ask you to collect data, and then we will, if you don't have a formal final Apache score in your electronic medical record, we ask you to enter all the data that are needed to calculate the Apache score, and Monica has already created, let's say, a system or an algorithm to calculate Apache.
So if there's an Apache score already filled out within the patient's chart, then we would just submit that score as opposed to filling out all the data that is required if there's no Apache form filled out. Is that what you're saying?
So if you have access in your medical record to a
Yeah.
final score, like a
Okay.
25 or
Okay.
30,
I see.
that if Monica and Julie, after the data collection, all the new sites, she will ask to monitor a few patients just to make sure that the questions were all well understood. So we must be able to see this final score in your medical chart. So that's if you don't have access to this final score, you will have to enter each of the data.
Okay, thank you.
We wanted to avoid like extra work for those who have already access to the final.
Yeah, I don't know if my ICU uses the Apache score. Maybe they do, but I can find out. Okay, thank
Okay.
you.
So 7 business days, yes, meaning December 18 until 23:59 on December 18. Any other questions? Feel free to send emails to Julie, Monica, and I. If when you go over the CRF or the operation manual, you still have some questions, we will make sure to answer these quick questions. And the video will be available on the website. So I think we'll end the meeting if no more questions. So thanks everyone. Have a good day.